Hello, my friends. Today I want to share a simple idea that can make a real difference for people who feel uncomfortable with their bathroom routine. Many of us notice frequent trips, a sense of incomplete emptying, or a slow stream, and we assume that's just part of getting older. But the truth is much more hopeful. Your bladder can often work better when you approach it with intention and awareness, rather than rushing or forcing. By treating urination as a gentle body skill that can be refined, many people notice more complete emptying, fewer repeat trips, and a calmer, more confident experience overall. In this video, I'll walk you through a 60-second routine that is easy to do, requires no special equipment, and aligns with how your nervous system naturally works. Recognizing the patterns. Let's first name the experience because what seems like 1,000 small complaints often share a common thread. Some people go to the bathroom, finish, and then suddenly feel they could go again just minutes later. Others notice a stop-and-start stream, a dribble after they think they're done, pressure low in the abdomen, or urgency that arrives suddenly. These sensations are often paired with lifestyle impacts, planning days around bathrooms, avoiding long drives, sitting near the aisle, skipping walks, or even turning down social plans because of uncertainty. It's important to see these as connected experiences, not separate annoyances. Recognizing the patterns is the first step toward regaining ease and confidence. Understanding the body. Many people assume that incomplete bladder emptying is about not pushing hard enough, but in reality, force often makes the problem worse rather than better. The bladder is a muscular organ, yes, but it doesn't work in isolation. Its function depends on a delicate, coordinated interplay between the brain, the pelvic floor muscles, and the urinary outlet. Even small amounts of tension, stress, hurry, or posture issues can subtly tighten the pelvic floor or urinary sphincter, creating resistance that leaves a little urine behind. For men, age-related changes in the prostate region can add slight resistance, while for women, factors such as pelvic floor tension, posture, history of childbirth, or hormonal shifts may influence how completely the bladder empties. In all cases, the underlying issue isn't weak muscles, but the bladder not being in the relaxed, aligned state it needs to finish fully. The insight is simple. Relaxing the system works better than forcing it. When people attempt to push out the last drops, the effort can backfire, creating strain and actually reducing efficiency. By contrast, helping the body find its natural alignment and calm allows the bladder to empty more completely and comfortably. Think of it like opening a door gently instead of ramming it. You get a smoother, safer result. This principle forms the foundation of a practical 60-second routine designed to support bladder emptying without strain. The first shift, relaxation over force. The first and most important shift is conceptual. Stop trying to force urine out. Instead, focus on creating the conditions that allow natural, smooth emptying. That means paying attention to posture, breathing, and gentle movement, rather than exerting muscular force. When the body is relaxed, the pelvic floor softens, the sphincter releases, and the bladder can contract fully. This approach reduces the sense of urgency, prevents unnecessary tension, and helps the bladder finish its job efficiently. For seniors or anyone who experiences mild incomplete emptying, this shift alone can make a noticeable difference. Instead of seeing urination as a race against time or a test of strength, it becomes a mindful, brief routine that works with the body's natural processes. The 60-second routine. Here's a simple routine you can practice anytime you feel rushed or want to ensure complete emptying. It takes about a minute and focuses on 4 key elements: posture, breath, pause, and gentle pelvic movement. Step 1. Posture. How you sit makes a surprising difference. Men may benefit from sitting on the toilet during this practice, while women can adjust sitting position for comfort and alignment. Place your feet flat on the floor, or use a small stool to raise your knees slightly above your hips. Lean forward gently, resting your elbows lightly on your thighs. This position helps align the bladder with the urethra, reducing unnecessary tension in the pelvic floor and allowing urine to flow more freely. Step 2. Breath. Take a slow, deep inhale, letting your belly expand softly. Then exhale longer than you inhaled, releasing your shoulders, jaw, and any subtle tension. Repeat this once more. The long exhale signals to your nervous system that it's safe to relax, helping both the bladder and pelvic floor to release naturally. Proper breathing reduces tension and encourages smooth, uninterrupted flow. Step 3. Pause. When the stream naturally stops, don't rush to finish. Stay seated and count slowly to 10, continuing gentle breathing. Avoid pushing or straining. This pause allows the bladder to reset and contract a second time naturally, helping release urine that might otherwise remain behind. Many people find that this brief, mindful pause is the key step they had been missing, and it often produces a surprising amount of extra emptying without effort. Step 4. Gentle second release. After the pause, try a subtle pelvic movement. Rock your pelvis forward and back once or twice. Lean slightly forward and exhale slowly. This gentle motion can encourage any residual urine in the bladder or urethra to flow out. After this final step, pause briefly before standing to give your body a smooth transition out of the seated position. Why this works. Understanding why this routine works helps reinforce the habit. The bladder contracts in response to signals from the brain, but if the urinary outlet is tense, the bladder may stop contracting prematurely, leaving a small amount behind. Leaning forward aligns the bladder with the urethra, creating a direct path for urine to flow. Supporting the feet reduces unnecessary pelvic tension, while long exhalations calm the nervous system and signal safety to the muscles involved in urination. The pause allows the bladder to naturally complete its contraction cycle, and the gentle pelvic rock releases any remaining urine. Together, these elements help the bladder empty more efficiently and comfortably, reducing strain and supporting overall urinary health. The beauty of this routine is its simplicity. It takes less than a minute, requires no special equipment, and works with the body rather than against it. Over time, practicing these steps can reduce the sensation of incomplete emptying, improve comfort, and make urination a smoother, more controlled process. Benefits of the routine. The benefits of this 60-second routine are both practical and meaningful. First, fewer repeat trips to the bathroom can dramatically improve daily life. When urine remains in the bladder after a visit, it can refill quickly, sending a premature signal of urgency. By using this routine to complete the emptying process, those signals are reduced, giving longer intervals between bathroom visits and less disruption throughout the day. Second, sleep quality can improve. Nighttime urination, or nocturia, is influenced not just by fluid intake, but by how fully the bladder empties and the state of the nervous system before bed. Completing the routine with mindful posture and gentle breath can reduce false urgency signals, promoting longer, uninterrupted sleep. Third, the routine can decrease pelvic tension. Straining or rushing can inadvertently create a feedback loop in which the pelvic floor tightens, making emptying less efficient. By practicing a calm, deliberate technique, this loop is interrupted, and the pelvic muscles learn to cooperate rather than resist. Fourth, improved confidence is a powerful benefit. Uncertainty about your bladder can restrict social engagement, travel, or even simple daily activities. Regular use of this mindful routine builds trust in your body, reduces anxiety about sudden urges, and restores freedom in daily life. Many people find that even small improvements in bladder efficiency translate into a sense of control that positively affects overall well-being. Removing hidden obstacles. Even a simple routine works best when paired with awareness of common habits that subtly interfere with bladder emptying. First, constipation or slow bowel movements can press on the bladder and change flow patterns, supporting digestive regularity through hydration, gradual fiber intake, and light movement after meals often improves bladder comfort. Second, rushing or hovering over the toilet can inadvertently tense the pelvic floor, making emptying less complete. Taking a calm minute to relax posture and focus on gentle release retrains the muscles for more efficient voiding. Third, breath holding, particularly at night, increases abdominal pressure and can signal the body to clamp down instead of relaxing. Using a long, deliberate exhale signals safety to the nervous system, encouraging the bladder and pelvic muscles to release naturally. Fourth, just-in-case urination, where trips are taken preemptively without a strong need, can train the bladder to signal urgency prematurely. By using the routine during clear need and pairing it with mindful timing, bladder efficiency improves over time. Awareness of these hidden obstacles, constipation, tension, breath patterns, and anticipatory voiding allows the routine to be even more effective, turning it from a 1-minute exercise into a tool for lasting comfort and predictability. Real-life experiences. Stories from real people illustrate how these small, mindful adjustments can transform daily life. One man, in his late 60s, felt trapped in a nightly loop, visiting the bathroom repeatedly before bed. Simply sitting with good posture, leaning slightly forward, pausing, and allowing a second release helped him empty more fully, reducing anxiety and giving him predictable, restful evenings. A woman in her 50s experienced frequent urgency, accompanied by tight hips and abdominal tension. By pairing a long exhale with gentle pelvic release, she learned to calm her nervous system, easing discomfort, and improving overall daily rhythm. Another retired teacher explained that the mental strain of bathroom uncertainty often felt worse than the trips themselves. The 60-second routine restored confidence, decreased stress, and allowed her to engage more freely in daily activities without the constant preoccupation with urgency. These examples show that improvement doesn't require drastic interventions or medications, just consistent, mindful practice that retrains both body and nervous system. Safety and awareness. While this routine is supportive and effective for many, it's important to recognize when professional evaluation is warranted. Sudden changes in urinary patterns, pain, blood in the urine, or a significant decrease in stream strength should prompt medical attention. The 60-second technique is not a replacement for medical care, but a complement for those with mild to moderate bladder concerns. With consistency, patience, and awareness, many people notice improvements quickly, often within days or weeks, as the body adapts to the mindful routine. By combining posture, gentle pelvic release, and calm breathing, you're not forcing the bladder, but teaching it to empty more fully and efficiently promoting long-term comfort and confidence. Easy to remember checklist. To make the routine simple and easy to incorporate, here's a step-by-step memory aid. Ensure feet are fully supported, lean slightly forward, exhale twice slowly, pause without rushing, count to 10, gently rock the pelvis, take one final long exhale, and stand calmly. If time or focus is limited, prioritizing the pause often makes the largest difference by interrupting habitual rushing. For additional benefit, practicing pelvic relaxation off the toilet once daily can strengthen this skill. Pair a long exhale with a mental image of softness, training the nervous system to feel safe in release. Over time, these small habits become intuitive, and bladder emptying becomes more predictable and comfortable throughout the day. A new perspective on your bladder. Changing perspective is key. Your bladder is not a source of frustration or failure. It is a communicator. Signals of urgency, incomplete emptying, or repeated trips are your body's way of prompting attention. Responding with calm, intentional technique rather than force teaches your system to empty efficiently. Complete emptying is rarely about strength. It's about timing, posture, and relaxation. The good news is that skills related to bladder efficiency can be learned and refined at any age. With consistent practice of the 60-second routine, you can transform your daily experience, improving both comfort and confidence. Understanding and respecting these signals allows for a more harmonious relationship with your body, replacing frustration with predictability and calm. Practical tips for daily life. Implementing this routine doesn't require major lifestyle changes. Small adjustments have significant impact. Ensuring adequate hydration throughout the day, balancing fiber intake for digestive health, and avoiding habitual rushing creates optimal conditions for bladder efficiency. Light movement, posture awareness, and mindful breathing reinforce the routine. Some people find setting a gentle reminder to practice the 60-second technique daily builds consistency until it becomes second nature. Even one mindful pause at a time of urgency strengthens the habit, gradually reducing false signals and improving overall comfort. Over weeks and months, these small changes compound into meaningful improvements in quality of life. Mind-body connection. The routine also highlights the mind-body connection in bladder health. Focusing on posture, breath, and relaxation encourages the nervous system to interpret signals accurately, creating a positive feedback loop. When the pelvic floor and bladder communicate effectively, urgency is clearer, emptying is more complete, and anxiety around bathroom trips diminishes. In this sense, the practice is not only physical, but also mental, reinforcing calm, awareness, and control. Margaret, a retiree in her 60s, noticed that the mental reassurance she gained from the routine, knowing she could fully empty and predict timing, was almost as valuable as the physical improvement itself. Confidence and calmness can spread to other areas of life, demonstrating how a simple, mindful habit can have wide-reaching benefits. Integrating the routine into everyday life. Integrating this routine into daily life is straightforward. Use it during regular bathroom visits, particularly when experiencing urgency or before bedtime. Pair it with gentle cues like counting to 10, breathing out slowly, and visualizing a relaxed pelvic floor. Over time, these small moments of intentional practice create a new pattern, retraining both muscles and nervous system for more efficient bladder emptying. The routine is also portable. It can be applied in any bathroom setting without special equipment. By practicing consistently, even once or twice a day in addition to regular voiding, the benefits grow steadily, and the feeling of control and comfort becomes more natural. Encouragement and consistency. The key to success is consistency and patience. Change doesn't happen overnight, but small intentional adjustments compound quickly. People who integrate posture, breath, and pause into their daily routine often notice improvements in bladder efficiency within weeks. They experience longer intervals between visits, fewer false urgencies, more restful nights, and an overall sense of calm in daily life. Mental reassurance is part of the process. Trusting that your bladder is communicating rather than failing allows you to respond thoughtfully and confidently, creating a positive cycle of comfort and predictability. Conclusion: start tonight if you've learned something new today. Try the routine tonight. Even small adjustments can produce noticeable results. Share your experiences in comments or with friends. Someone reading may feel less alone in their bladder journey. By practicing posture, breath, pause, and gentle pelvic release, you can transform your relationship with your bladder from frustration to confidence. Consistency builds skill, and with time, the 60-second routine can become a source of comfort, predictability, and ease. Your bladder can support your life rather than disrupt it, and with mindful, deliberate attention, small daily habits can produce lasting, meaningful improvements in both comfort and confidence. Start tonight and notice how simple, focused practice creates a new rhythm of calm and control.